everyone, today I'm gonna show you how to dissect the pig kidney. So we have here the renal cortex is where the nephron's blood filtering units begin. Ureter is transporting urine from the renal pelvis into bladder. Renal ileum region leads to a large cavity called the renal sinus within the kidney. As you can see, this is the renal artery. It carries a large volume of blood from the heart to the kidney. Next, we have here renal veins carry filtered blood from the kidney to the posterior vena cava. And also, we have here the hilariar fat pad. Soft padding tissue. Fat cushions the body, provides padding between organs, and helps keep the body warm. A kidney vein shape with both convex and concave borders. So now we're going to dissect the kidney. Cut the kidney in half lengthwise from the side. Do not cut until you have checked and sure of correct direction of your cut. As a surgeon, you only get one chance to cut and there's no way to redo this. After splitting the kidney in half, we'll reveal its internal structures. So after the cutting, we will examine the kidney and identify these structures of the kidney. After the cutting, this is the structures of the kidney. So I'm gonna show you the structures and level of the kidney. So now, as I have said, this is the structure of kidney. So we have here the renal cortex is the solid looking outermost part of the kidney. It contains many small arteries and veins that carry blood to and form approximately 1 billion nephrons located in the cortex. Renal vasculature to check the blood flow in your arteries and veins. The medulla is the region located inward from the cortex. It includes the cone-shaped renal pyramids. These are the fibrous substrate triangle zones in the medulla that contain the collecting ducts, which collect urine from the kidney tubules of the nephrons in the cortex. Between the pyramids are the renal columns that contains middle-sized arteries and veins that carry blood between the nephrons in the cortex and the renal artery and vein. The hollow area in the center of the kidney is the renal pelvis, which should not be confused with the bone called the pelvis. The collecting ducts drain into the pelvis. From there, the urine passes out through the ureter to the urinary bladder. A minor calyx surrounds the renal papilla of each pyramid and collects urine from that pyramid, while minor calyces converge to form a major calyx. From the major calyces, the urine flows into the renal pelvis, and from there it flows into ureter. The function of fibrous capsule is to help to support the kidney mass and protect the vital tissue from injury. So this is the closer look of the structure of kidney. As you can see, this is the segmental arteries. So the segmental arteries are functional to end arteries since they serve as the only supply of oxygenated blood to their particular region of the kidney. So here is the medulla. Is what I'm pointing right now, the medulla. And next, this is the cortex here. You can see. And also in the left side, it's also called cortex. So after identify all the structures in the kidney, then we should clean all the equipment that we use for dissection of the kidney. So we should use the detergent, put in the equipment, then use a punch to clean the equipment that we use. And after cleaning the equipment with sponge, we need to wash the equipment with water to clean up the equipment tools. After finish cleaning up, wash your hands with water and apply detergent or soap to cover hand surfaces. Rub the hands palm to palm. And right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Back of the finger to opposing palms with finger interlock. Rinse your hands with water. After you're done washing your hands, turn off the faucet. Dry your hand by shaking your hands. And now, your hands are now safe.